So today I'm going to be performing trach care, so I just want to make sure that I get all my supplies in order, check my doctor's orders, and now I'm going to go introduce myself to my patient. I'm going to perform hand hygiene and introduce myself. So hi, my name is Ryan. I'm going to be your nurse today. Could you just verify your name and date of birth? Okay, thank you. I'm just going to be doing trach care on you today. Is that okay? Okay. So I'm gonna be making sure that I look and scan the room for their emergency supplies, which they have, so that's great. I'm gonna start by putting on their pulse ox to read their saturation, and then I'm gonna go ahead and pre-oxygenate my patient. So I'm just gonna go ahead and put some gloves on. Okay. So I'm going to make sure the bed is no more than 30 degrees, and I'm going to remove my patient's oxygen that's already there. Make sure my oxygen is set to 15 liters, and I'm just going to attach and give a few breaths with 5 to 6 seconds in between. Okay. So now that I've oxygenated my patient, I'm going to put back their collar here. And then I'm going to put a little dressing down just to catch any secretions while I'm suctioning. So now that I've done that, I'm just going to go ahead and remove my gloves. I'm going to perform hand hygiene and open up my packaging. So my trach care, my sterile water, my suctioning kit, and my new inner cannula. I'm going to go ahead and put on my glove. That's going to indicate my dirty hand. And I'm going to go ahead and open up more of my suction kit to get my sterile gloves out. Okay, so I have my sterile glove on. Let me see. Okay, there we go. And then I'm going to go ahead and take out my catheter to do the suctioning. I'm going to lubricate it in my sterile water, and then I'm going to go ahead and attach it to the suctioning. Okay, I'm going to engage my suction. I'm going to remove their oxygen, and I'm going to warn them to just catch their breath. I'm going to insert the tube, and then until they cough or meet resistance, then I'm going to engage the suctioning only as I'm pulling out, and no more than 10 seconds. I'm going to check the color of their secretions. Alright, and then I'm going to throw this away. Alright, and then I'm going to go ahead and clean their trach. So I'm just going to go ahead and take away with my dirty hand their dressing and their inner cannula. Alright, and then with my clean hand, I'm going to go back in my kit, my trach care kit. I'm going to go ahead and take my swabs and some gauze to clean. I'm going to go ahead and put my sterile water on there. And I'm going to be cleaning around their trach. Get all those secretions off of there. If they have any sutures, I want to make sure I'm going under there to clean that as well. Okay. Once I'm done with that, I'm gonna go with my clean hand and put in their new inner cannula. Be sure to only touch the outside of it, and I'm just gonna go ahead and put it downwards until I hear a click and paste. And then after that, I'm just gonna go ahead and put back their oxygen after I put on their new dressing. So I'm just gonna do that. Okay. Make sure that's nice and secure. I'm gonna go ahead and put back their oxygen. And I'm gonna remove my dressing here. Alright, I'm gonna make sure they're comfortable. Take off their full socks. I'm going to perform hand hygiene, and then I'm going to document. And I'm going to make sure that I'm doing my trach care at least once a shift or every 4 hours or as needed.